I'm Dr. Lisa Gordon. I'm a chiropractor in Columbia, Maryland. I've been in practice since 1987, and I have treated a number of people for just structural chiropractic. And some people have more specific needs, like they really do get a lot of allergic responses that just don't get better, even if we deal with the chiropractic piece, the structural, and even if we deal with the nutritional piece of that. The program is huge. And even though I've been doing this work, I think since 2006 or so, I keep finding more ways to use it. And that is very exciting to me as a practitioner. So AAT has helped my practice in that it's helped people know that they can get help with AAT that maybe they couldn't get elsewhere. A lot of people don't want to have allergy shots, but they'd rather use AAT because it's non-invasive, for instance. AAT has been very beneficial for me in my practice and for my patients. Before using the AAT expert system, I didn't have a very good way of handling people's allergies. What I tried before that didn't work well enough, did work in many cases, but didn't work as well as I wanted it to, was some chiropractic adjusting and some applied kinesiology techniques. Again, these things did work with a lot of people, but I wanted to get more in depth. Results from using the AAT expert system have been quite variable. I've been doing it for a very long time, and I've helped people with everything from hay fever to eczema to anxiety to bladder function, mold allergies, repeated sinus infections, all kinds of things. Some people only come for AAT. Some people are already patients, and as part of their treatment program, we add AAT. AAT was a rather small part of my business in the beginning, and recently I've been getting more people who want to get treated before the spring and the fall, for instance, because those are times when people get a lot of hay fever and skin issues and that kind of thing because of environmental allergies. I've also treated a lot of babies who have sensitivities even to their mother's milk, so the mothers can continue to breastfeed the babies. It's quite variable, actually, and people come from far and wide. It sounds a little funny to say that, but people come from kind of far away because there aren't too many people doing this work in my area. Well, I've been doing muscle testing for 45 years, so I know how to muscle test. So for me, I didn't have to relearn that, although there are some variations in the method of muscle testing that AAT uses. So there was a bit of a learning curve there since it's so specific. And other than that, I found it very easy. I point and click and I talk to the patient just a little bit. And I think part of it was just like anything, gaining the confidence and doing it enough to feel confident doing it and not overdoing and not underdoing. I have found it to be extremely useful. I would recommend it to somebody who wanted to branch out and do something additional to their chiropractic practice. And if they were thinking in terms of a more holistic way of treating the people in their community, it would be a great thing to add.